everyone faces the same challenges, and I separate everyone into categories. So there's some people who can implement it right away, like you, Dr. Pal. I would call you a virtuoso. You're in that category of, you demand that change for yourself, and so you will put everything into place to make that change happen. But many other people are obligated. I call them the obligated eaters. So they have to eat when someone else is eating. Otherwise, they're not allowed to eat. They're obligated to eat at the spouse's time, or the children's time, or the visitor's time. And then there's people who are compassionate eaters. So people who have to eat because they feel emotionally drawn to the food in the evening. That's what helps them calm down. But what's an interesting aspect about the different times of eating is that what we have found in looking at many, many people trying to adopt time-restricted eating, some who've been successful and some who've not been successful, is that the people who have the most difficult time adapting to not eating late at night are likely having mild hypoglycemic events. Your blood sugar may not be dropping into the low range of very, very low, like, 60s or below, but their sugar's beginning to slowly drop a little bit. So it drives the nervous system to need to eat something, right? Because you start to feel a little bit uncomfortable if you don't eat something. So that fasting interval is important, but getting to the fasting interval and adhering to it means eating the better or the right kind of food during the day, enough fiber, enough vegetables, so that you don't experience a drop as you go later into the evening, 9 p.m., 10 p.m., when you're trying to begin your longer fast.
So initially, when we start this, at least when I started this with you, you said that don't worry too much about what you were eating initially, and then just focus on the timing period initially, and we can modify what you're eating later. I think that worked for me because I don't want to focus on too many things at the same time.
Right. So if you're able to begin that process and you're beginning your evening fast and you don't have any side effects, you don't feel jittery, nervous, sweaty, tremors, then you could probably implement it just as you said. But if you run into these obstacles where, for example, a family who's eating at 10 o'clock at night, their ability to fast after 7 is going to be very difficult.
Yes.
Because they're starting out at a very late time of when the body's already imprinted to eat. That's already a habit. The body's hormones and digestive system is set for 10 p.m. So you're trying to reset it for 7. So the body's going to have some symptoms of almost like withdrawal from that usual habitual eating time. So that's when, if you're facing that obstacle, then just try to incorporate a little bit more during the day. So the key is shifting food, not saying I'm just beginning my fast now and I didn't eat any breakfast or lunch and now let me begin my fast. So you're shifting food so that you don't experience any of the problems or the obstacles of trying to begin that short evening fast.
So when you say shifting food, is let's say you have a heavy dinner, don't have a heavy dinner, save that 50% of dinner to breakfast or lunch maybe.
Yeah, it's best if you can have a heavy lunch, have a bigger breakfast. We did begin by, as you said, just having people ignore the food aspect of it. So if you're just beginning, you can eat what you like to eat during the day and try to have a bigger lunch and a bigger breakfast, and then try to shift the majority of the calories away from that last meal.
Right.
So that's a good place to begin. And then as people are beginning to shift their evening time meal up, then gradually we will look at composition a little bit to help them not feel the side effect of the short evening fast. But if you don't feel any side effects from it, you don't have to worry about that. You can just begin your fast.
Right. So most common question that I got was people with night shift. If they're working night shift, how does this work? What do you usually tell that to your patients?
Well, it depends on what night shift they're working. So when I coach my patients, I look specifically at when their night shift is, because we have true night shift, like nurses who work 7 p.m. to 7 a.m. And then we have swing shift workers that may work from, something like 9 or 10 p.m. until only 2 or 3 a.m. So night shift and swing shift, different hours, but during the night. Now, I do have someone who is a swing shift worker, and she has been able to reduce her fasting blood sugar. So she's a diabetic. She's been able to normalize her blood sugars just by using time-restricted eating. But how she does this is she is done by 7 p.m., regardless of if she has to go to work at 9 p.m. and work until 3 in the morning. So she continues her fast even while at work. That's not easy to do, but that would be the ideal for someone who's working swing shift, is to treat it as it's still your nighttime circadian pattern. So you still want to try to do as much fasting as you can during that nighttime cycle. So you can just think about it. When everyone's sleeping, your digestive system should still be sleeping, right? When everyone's up and eating, that's when your digestive system should be awake, up and eating. Now, you may be sleeping because you're on swing shift, right? You're sleeping, it's like 3 in the afternoon, you're sleeping, but at least let your digestive system, let that be awake. Yes. So as soon as you get up, go ahead and eat something, or when you get home, go ahead and eat something if the sun is out. Because remember, circadian is day and night. So if the sun is out, it's daytime for your digestive system. Make sure that it's digesting. It wants to during the day. And then at nighttime, when it's dark, everything's shut off. Your digestive system is sleeping. So the best you can align your eating pattern to the day and your fasting pattern to the night, even while on a swing shift or a night shift, that serves your health the best. It serves your organs the best.
So I'm going to be honest with you, Julie. When I started, right? So I was really concerned that what if I become hungry at night? Will I be able to work properly? I'll be able to focus a lot if I'm on call. Later on, it eventually went away. But what do you suggest to your patients?
Well, certainly for you, Dr. Pal, I know you're on call all night long. And so it's going to be 2 a.m. and you're still up walking around the hospital. So I can't even imagine how hard that was when you were beginning that fasting cycle, to begin with. But in the beginning, for certain, the first 2 weeks are the most challenging. Maybe a little brain fog, a little fatigue, maybe some indigestion. Your body's adapting. But just as you noticed, it gradually goes away until to the point where probably 3 to 4 weeks later, your body is different when it's doing its nighttime fast. And then at 2 months, again, it's even more different. And then at 3 months, it's almost like martial arts. The longer you do it, the more you advance. You go from white belt to brown belt to yellow belt and then black belt. So your body is different when you begin versus when you're at 6 months to a year. And so you feel fewer and fewer side effects to the point where you feel good when you're doing your nighttime fast. It's become like a black belt,
Wow, right. I feel like at this point of time, I'm just wearing the karate dress now. I'm not even putting the belt on. So it's still a lot of time for me to advance as well. So, one most important thing that you mentioned was you said your patient actually was able to decrease the glucose levels and reverse the diabetes almost. Is that right? What is
Right.
your experience in those patients?
Well, how they begin is they are doing just like everyone else is doing. They're beginning to move that last meal of the evening, move it up by 1 hour. Just start there. And as you gradually begin to move it, you'll see your morning fasting blood sugar start to come down. So as you move the evening meal, check your morning fasting blood sugar and see how that adjusts. And I think you'll be surprised. It always begins to lower as you move that meal up. And you don't even have to change composition. That's the surprising thing. You're really not changing what you're eating. And that's the beauty of time restricted eating, is that, it really is. All of the researchers say that. So everyone at Dr. Panda's lab says it's not what you eat, it's when you eat. And that's such a hard concept to really absorb, because it's almost like when someone says, when you travel at the speed of light, time changes, and that's like, how do you fathom that. That's
Right.
so difficult. It's such a difficult concept. And so when people first hear about time-restricted eating, they may sort of think that it's just a mundane recommendation, but it's so powerful. The power behind it, once you begin consistency, you can begin to look fantastic like you, Dr. Powell.
I think you may be the only person that says that, but that's okay. Yeah. No, you're totally right. You're totally right. I think when you said the consistency, so the next problem that I faced was, even if I was okay and I want to follow this, my friend calls me on a Saturday night for a potluck. I just go with the pot, but there is no luck because I don't eat after 7 p.m. So peer pressure, right? That's one of the main thing. And what do you advise to your patients in that aspect?
That's a really good question. In fact, I have a woman who works with me, and she is what I call, she's an entertainer, because she is always having people over. There's always an activity going on at her house. They're hosting a party, an anniversary, a birthday. So when it hits 7 o'clock, she takes her glass of wine and she dumps it out and she fills it with water and she walks around as if she's drinking white wine. So everyone thinks she's still enjoying her cocktail. I think that's going to be more difficult to do with food, Dr. Powell, but I'm sure you could find a way to walk around with your plate of food and pretend like you're eating.
So, what I have done before is I take like an Indian food, like 2 pieces of it, and I don't eat it at all. I just talk to all these people with the exact same tone throughout the night. And there's a thing in the Indian culture that they would put everything down to entertain the guest. The guest is like more than the god in terms of hospitality wise. So they will provide everything what they can to please the guest so that they have a good time. But it is very hard for me to explain that please don't give me anything to please me.
So the solution would be 2 plates.
2 plates, exactly.
Full.
Right. 2 plates. And I want to tell about this mutual patient that we had. That patient had diabetes and that patient had fatty liver as well. So the endocrinologist sent it to me for the fatty liver, and then I sent it to you because I know that both me and the endocrinologist are not going to do anything for that patient, and you can do a lot for that patient. So why don't you talk about fatty liver on that mutual patient as well?
Right. So the diagnosis of fatty liver is done first, and that's done by, like you, a gastroenterologist specialist, right, Dr. Powell, and we look at the blood tests. So when we see that the blood tests for the liver are elevated, that's an indication. But ultrasound is another indication, because sometimes we don't see it on the liver tests. But of course, you can tell by the waist circumference too. You can pretty much judge by that. So fatty liver, of course, is really concerning because that the liver organ itself detoxifies the blood and it cleans the blood. So if you have fat on your liver, it's bundled with layers and layers of oil and grease, preventing it from doing its job. It's like a dirty sponge. Who wants to clean the dishes with a dirty sponge? Right. So getting rid of fat on the liver is what the body wants to do first. And what we've noticed is that people who do calorie restriction diets do not lose fat on the liver very well. In fact, it's one of the last places that the body will go to clean. But it's the reverse with time-restricted eating. It seems to target fat on the liver. It seems to allow the body to get to where it wants to clean the most. So it's sort of like your kitchen. And the dirtiest part is in the back of the refrigerator. And nobody ever wants to clean that because you can't see the difference, right? You just close the door and your house, if you just clean the outside of the house, you get much more aesthetic appreciation, right? So the liver is always ignored when we do a regular standard diet, except with time-restricted eating. It allows the liver to just take the layers off. So initially, with this type of protocol, you won't see active weight loss. you won't see aggressive weight loss because all the work is being done at the organ level. The liver itself is cleaning. It's a self-cleaning process. And the liver has all these nooks and crannies to it, little tiny canals and channels. And when they're filled with fat, your body has to take those little pipe cleaners, that we use to clean small straws. It's almost like it's taking pipe cleaners to clean the liver. But that's not a lot of fat that comes off eventually. It doesn't weigh a lot, but its meaning is huge. It's profound. When you can take fat off the liver, the impression for your body is huge. The blood is cleaned. Your metabolism starts to go up. So the case with this patient was we just began by studying her eating pattern. And she was eating until 11 o'clock at night, yet regularly, because she worked during the day and all her stress was during the day. Then we gradually started to move her dinner time back. Now, she got to 8 o'clock. And even though that's late, it's still considered relatively late circadian-wise. We started to see liver ultrasound changes, blood test changes, and weight loss. So for your viewers that are eating very late, the most optimal message from this is that if you even shift by 1 or 2 hours, it's going to make a dramatic difference on the health of your organs.
Wow. That patient was an eye-opener for me as well. I can clearly see that the numbers of the liver enzymes were completely trending down to almost normal. So it was an eye-opener as well. But the most important thing is consistency, isn't it? You cannot do this on a weekday and then get away with the weekend.
Right. Because if you think about it, the first thing many people say, at least the ones that I meet, the first thing they say when they learn about time-restricted eating, simple concept, they're already thinking to themselves, oh, I already do that. I do that. I'm done with dinner by 6 o'clock. But they're done with dinner by 6 o'clock only 80% of the time. 20% of the time, they're not. And if you're 80-20, it doesn't work. It doesn't work. Because this circadian cycle has memory to it. And so it requires repetition and it requires adherence on a consistent basis. Now, for someone who's got a longer legacy effect, for example, someone who's been using this for many weeks already, they do get maybe a one-day pass. So they have one day where they eat late at a gathering. That's maybe okay. But they go 2 days or 3 days, you're starting all over again.
That's right. Exactly.
Yeah. So you do build up. It's almost like how at work, if you work a certain number of days, you can gather a vacation day, right?
Yes.
It's like that. You have to work a certain number of days before you won't have a dramatic consequence from falling out of that eating time.
It's like me going to the gym. I go for like 1 week and expect the muscles to build up. It is not there. I stopped. So it has to be persistent and consistent. And as you said, even after doing like 2 or 3 months or even more than that, then you might take like 1 day of vacation, so to speak.
Yes, but not an extreme vacation, just a very local vacation.
You can go to India. All right. So the that is the only thing I thought it was difficult for me initially to adopt because of the lifestyle change. But eventually, when I tried to change the lifestyle for my family, for my friends around, then it was a little bit easier for me.
Yes, I think that if you can have a community supporting you, it always works better. In fact, the most successful people who I have coached doing this method have been couples, a married couple where both are motivated to use time-restricted eating. That's the most optimal scenario. But if you have one spouse and another spouse that wants to eat at a different time, then it becomes more difficult because you have someone eating late and someone eating early.
Right, absolutely. And my wife says that, circadian rhythm will work the other way around as well. Because she eats late at night at 2 a.m.
Oh.
Then after, looking at my change, she changed as well. So,
yeah.
So I think people has to notice that change And unfortunately, it's going to take some time. It is not going to happen overnight. At least in my case, it took like 6 to 8 weeks at least to notice some change.
Right. Right. So I see metabolism as it kind of stays steady, and most people expect that it's going to rise like a slope. But really what we've observed is it stays steady and then it rises quickly, it stays steady, and then it just does another quick rise. So it almost like it plateaus until you continue and be persistent, and then it moves up to the next level.
Wow. Wow. This is so fascinating, and I'm pretty sure that we'll not be able to complete everything within this one session. And so, audience, please, if you have access to Amazon, please order that book and then see. Julie has clearly explained in basic, simple steps that everybody can understand regarding how to incorporate this time-restricted eating initially when you are coming to know about this. And I'm pretty sure that she will be happy to come over again on our channel to explain more about it. Even if she doesn't, now she has to, because I explained that in front of you all. But we work together and we have so many mutual patients. We love this concept and we would want to share this concept to everybody. And thank you so much. This has been a wonderful session, Julie.
Thank you, Dr. Pal.
Thank you. Thanks a lot.